Hello guys, welcome to my channel. This is Dr. Babalola. This is Health Discourse, Ask the Doctor. In today's video, I'll be discussing with you appendicitis. Appendicitis is quite common in terms of occurrence in our society, and in terms of awareness, a lot of people are conversant with that name appendicitis. However, a lot of people are not aware of the symptoms or the clinical manifestation of the disease. And however, people also mistaking it for a lot of things in terms of confusing the pain associated with another thing. So today I'm going to be explaining in a layman language what appendicitis is. Appendicitis simply means inflammation of the appendix. The body is made up of certain tissues, organs and systems. Part of the organs in the body, or in terms of small structure as a component of the intestine, is the appendix, which is located close to the cecum, which is close to the colon, which is the large intestine. In a layman, the intestine contains small intestine and large intestine. So at the corner of that large intestine, where the small intestine is connecting with the large intestine, is where the appendix is located. Is a small tube-like structure that is forming a kind of a diverticulum away from the colon. As a matter of fact, it doesn't serve any major function in the body. However, it houses remnant of digested food, and in course of doing that, it also houses bacteria or any other form of microorganism that can get the place infected. And when that structure, the appendix, is infected, it can over time swell up and burst. Over time undergoes recurrent healing and also infection again, and also healing, thereby leading to severe pain in such an individual, such that when an individual is coming down with appendicitis over and over again, we always advocate as a form of prevention that the individual even go ahead and remove it via surgery. So this is what we call appendicitis, inflammation of the appendix, which is located at the lower right side of the abdomen, at the point of connection of the small intestine to the large intestine at the colon there. So what are the symptoms that the individual is going to manifest or is going to notice when the individual comes down with appendicitis? The major one and the frequent one is that pain. However, the location of the pain is essential because the pain could be mistaken for another thing entirely. So the pain of the appendicitis most of the time starts just close to the navel, and from there it could migrate to the right lower part of the abdomen. However, in female, this could be mistaken or be confused with right ovarian cyst or infection of the right ovary in female, because the right ovary is located just close to that area. So in male, it could be easily diagnosed, but in females, there will be a high sense of expertise to be adopted in order to be able to know what is what. So as a result of this, you can't just say any pain coming at the right lower area in female is appendicitis. Not at all. There will be need for thorough evaluation and thorough investigation to be done in order to be able to know what is what. But most of the time, appendicitis is a clinical diagnosis because the symptoms will have given it away. So this pain is a form of colicky pain, like a coiling pain, squeezing pain that you feel at the navel area, or over time it moves to the right lower part of the abdomen, which we call the right iliac fossa. So apart from this pain, the other thing that will be noticed is that feeling of nausea, as if you want to vomit but the vomiting is not coming. Some could even vomit entirely. The other thing you also notice is that fever, high grade fever, in some moderate fever. The other thing you also notice is that chill. So all these actually, aside from the pain, a form of symptom that you will even notice is someone that is having malaria. But then this abdominal pain will be there as being a major player, as a matter of fact. So these are the symptoms you will notice, but the major thing I want you to take notice is the nature of the pain and where the pain is usually being felt. Do not forget this. If you must forget anything, don't forget that there must be abdominal pain, and the abdominal pain will usually be around the navel, and over time migrate to the right lower part of the abdomen. And I also said in female that could also come with a form of differentials, because at the right lower part of the abdomen there are other structures in female that might just give it away for any other thing aside appendicitis. So these have been known, the symptoms have been known. What are the modalities of management? Appendicitis can present in three major ways. It could be acute appendicitis, it could be subacute appendicitis, and it could be ruptured form of appendicitis. I must say the ruptured form of appendicitis is the one that will take it away from a medical care entirely to a surgical care, because at that stage what will be required is surgical care. Surgery will be required as a form of emergency at that state of rupture. But if it was this level of acute appendicitis or subacute appendicitis, intravenous antibiotics will be the major player here, which is going to mop up inflammation. The other thing that will be required is analgesic, antipyretic agent to take care of the eye fever. The other thing that will be required is to take care of the other symptoms accordingly. If the individual is vomiting, you give antiemetics that will be able to take care of the vomiting. And if there are other symptoms, that will be instituted. Mind you, depending on the severity of the illness, admission will just be required based on the severity of the illness. And for those that are stable after antibiotics administration, what we always advise is that if they come up with another episode of the same appendicitis, what we always tell them is that over time we plan them for elective appendectomy, which is surgery, as a form of a way of taking care of that entire, so that it wouldn't occur again. The initial form of management, whereby antibiotics are being used and every other medications aside surgery, we call it conservative management, because we just want to be conservative in our approach. We don't want to be invasive. But then if it's recurring over and over again, there will be need for the individual to be planned for surgery to remove it, because it's not even serving any purpose. Yet over time there will be that irritation of the area due to the recurrent inflammation that is occurring in the appendix. I haven't listened to this. I'm sure you are clear in not confusing appendicitis pain to any other pain that you might notice over time, and then the approach towards taking care of that. Don't forget to subscribe to this channel, share this video for as many that you know is going to be of benefit to. Click like this video as well. Let me receive your feedback through the comment section. I so much appreciate that. Till I see you next time, bye for now. Thank you.